Remember how Obamacare is built on the premise that young, healthy people like me will enroll and shoulder the costs for older, sicker people? Well, that's not how it's working out. A recent report shows that people enrolled under Blue Cross Blue Shield healthcare plans via Obamacare are less healthy than those insured under the same plans via their employer. Obamacare enrollees had a higher rate of diabetes, depression, heart disease, and the costs were 22% higher under Obamacare than the same plan through the employer. Yet Obama's choosing to brush this policy failure under the rug and instead focus on opioid use. Check it out.
This is something that has been a top priority of ours for quite some time. My job is to promote the safety, the health, the prosperity of the American people. When you look at the staggering statistics in terms of lives lost, productivity impacted, costs to communities, but most importantly, cost to families from this epidemic of opioids abuse, it has to be something that is right up there at the top of our radar screen.
Joining me now is world-renowned cardiologist and author of Losing Our Way in Healthcare, Dr. Kevin Campbell. Dr. Campbell, thanks for being here.
Thanks so much for having me tonight.
All right, Dr. Campbell, our president, as you heard, compared opioid abuse to the threat of terrorism. This after he all but ignored Brussels. Doctor, as a medical provider, what do you think of that?
Well, certainly opioid abuse is a problem, but it accounts for about 50,000 deaths a year in terms of overdoses. And I think we can all see and agree that global terrorism is far bigger problem than opioid abuse back home.
All right, for those of us who don't work in the medical profession and might not know, doctor, tell us, what is an opioid?
These are prescription painkillers like Vicodin or OxyContin. And then there's illegal drugs like heroin, which can be smoked, inhaled, or ingested or injected. And these are opioid type drugs.
So is the opioid abuse that our president's talking about, or that you cited this statistic of 50,000 deaths, is that from prescriptions, overdose of prescriptions, or overdose of illegal drugs?
Some of both, because both of these drugs have the effect of suppressing our ability to breathe. They give you a big feeling or a high, a euphoric high, and that's why it's very, very addictive. But at the same time, it suppresses your brain's own ability to think about breathing, and that's where these overdoses come from.
And that's really two separate issues then policy-wise for the government to deal with, how to deal with overdose of prescription or abuse of prescription drugs, because that has to do with access and medical providers prescribing, and then illegal drugs, which doesn't just have to do with the drug itself, but the whole network of drug dealers and distribution and all that. Doctor, is this the federal government's job to fix this?
Well, certainly from a drug abuse standpoint, I think the federal government needs to be involved in the drug dealers and policing the drugs that are coming now from Mexico as well as from other places overseas. A lot of this has to do with our very porous southern borders. But I think in terms of policing physicians and their prescribing plans, I think we're trained professionals and we know how to prescribe these drugs. The problem is there are patients that are getting them and then selling them on the street.
Right, and President Obama wants to use $1.1 billion of our tax money, which is triple the current levels, to address this problem. What's that money going to go towards?
I think what they're talking about doing is developing more clinics, more access to care, more places where folks that are addicts can get counseling. This is all important, but I'm not sure it's our top healthcare priority. Also, I think that these drugs really, we've got to figure out why people are using them. And in my opinion, part of it is the fact that no one has jobs, the economy has tanked, all due to these failed policies by the Obama administration.
So in your opinion, and this again as a medical provider, is your opinion how to fix the problem than to focus on the outside issues, the economy, people's family, their social support system, or is it something, or how do we go about fixing this?
I think it's a very complex issue, but I think it's got to be multifaceted. I think we certainly have to go after the underlying cause. We've got to get these folks employed. We've got to give them a meaningful career. We also have to figure out how to stop the distribution of these drugs, both illegal and legal, across our borders.
Right, and another thing President Obama was talking about is support for a reversal drug that essentially takes all the effects of these opioids and reverses them so that you don't die, so that your body doesn't listen to the initial drug. Doctor, tell me a little bit about that.
So the drug is called Narcan or naloxone, and this is a drug that blocks the effects in the brain and the spinal cord of the narcotics or the opioid pain reliever, and it can be life-saving. We give it in the hospital in the emergency room because it stops the opioids from acting when they do. So having these available to EMS and available in emergency locations, I think, is a good idea.
All right, let's switch topics and talk about Obamacare here, because call me a skeptic, but I do feel skeptical whenever our president wants to get involved in our healthcare choices. And I agree with you. I think that opioid abuse needs to be addressed, certainly, because it's hurting our families, it's hurting our country, it's hurting people. But President Obama building more bureaucracy never seems to me to be the answer, particularly because we're just reading these reports that Obamacare enrollees, those who enroll in health insurance through Obamacare, are actually sicker and have higher costs for their health than their counterparts who get the same plan through their employers. Doctor, what do you think of this?
I think we all saw this coming. This provides access for all, but it provides no individual accountability. So in other words, you can continue to be overweight, you can continue to smoke, participate in high-risk activities, risk for heart disease and other chronic diseases, and you still get Obamacare. You don't have to worry about pre-existing conditions. So these are older, sicker patients with multiple medical problems, and we really penalize the young and healthies, like we talked about earlier in the segment.
Is that sustainable? How long is that going to be able to last before the whole thing just tips over the edge?
We talk about repealing Obamacare and healthcare reform and reforming the reform. We're going to have to do something at the legislative level, because either we do nothing and it's going to implode because it's not sustainable at this cost level, or we get in there and make some sensible changes that provide access in a physically responsible way.
All right, doctor, and this might be a trick question, but who's the best one to fix this? The doctors themselves, who know the ins and outs of the healthcare system, the people who don't want the government in charge of their lives or making decisions for them, or government who knows how to administer bigger bureaucracies?
So here's where I think we have to all come together. Physicians did a very poor job of being involved in the Affordable Care Act. We just let it happen around us. I think as physicians and providers, we have to be involved. I think patients need to be involved in advocacy groups. I think government has to write the rules, but at the same time, I don't want the government in the exam room or the operating room with me and my patient. That's a sacred place, and they need to stay out of there.
Right, and in my opinion, and I'd like to hear your opinion on this too, is I think that's best done at the state level if government needs to be involved at all, and the federal government just stay out of it completely.
I think that's a great idea, because every state has different health challenges. Rather than a one-size-fits-all plan, maybe getting the state legislators together and deciding what's best for the needs of that particular state. I agree with you.
All right, doctor, it's always great to talk to you. Thanks for coming on the show today. Coming up, we've seen the consequences in Europe of countries who open their borders to millions of refugees and migrants. Wait till you hear the number of migrants from Muslim-majority countries that Obama's letting into our homeland. That's after the break.